So, um, I was in the pediatric unit again, and I loved it. Um, my patient that I chose to do my worksheet on is a 14-year-old female. Um, she, her history, she has a genetic a genetic syndrome. It's called Holt-Oram syndrome. I had to look it up to find out exactly what it was, but basically it was a genetic caused deformity in the upper extremities, and it also involved heart issues. So she did have some cardiac issues. I think it had something to do with the septum. I think I wrote it down somewhere, but now I can't find it. So she also has had respiratory failure in the past. In 2015, she had an AVM, which is kind of like a clot in the brain, and she had a brain hemorrhage. She ended up being in the ICU for 29 or about 2 months. She was on the vent for about 29 days, but this particular patient, it was really interesting that she just her history and her background. I'll tell more in our post-conference meeting. But she also, as she was growing, they think it's probably has something to do with her her Holt-Oram syndrome. Developmentally, she had really bad scoliosis and something called spondylolisthesis, I believe is how you pronounce it. Basically like a slip disc. So she's had a lot of surgeries on her back. So the reason that she's actually in the hospital, she was recovering from a spinal fusion surgery. Also, they did an allograft and an autograft. Those are both like two different things, so I'm not exactly sure if they did both or if that's just what it said in her medical chart. So she was alert and oriented ×4. She was in a lot of pain. So that was the main problem to address with her. Clear lung sounds. She didn't have any wheezing or crackling. She had pretty normal bowel movements. Her urinary output was normal or was within normal limits until they realized kind of at the end of the day, they tried a different concoction of medication to try to help her pain. And it really kind of put her out. She was pretty tired. So we had to do, later in the day, we had to do another kind of like a neuro assessment to make sure that she was just sleeping and not having negative effects from the medication. So she did arouse pretty easily. So I think she was just really tired from not sleeping and being in pain the night before. But she also wasn't putting out very much urine at that time. And we did note that her last blood pressure was pretty low. So the nurse had to order fluids for her to try to, or she didn't order them. She talked to the provider to put in an order of fluids to help get her blood pressure back up. So her vitals, her temperature was 97.6. Heart rate was elevated, 109, but that was to be expected on some of the medications that she's on. 99% oxygen on room air. Her blood pressure was 99/51 early on in the morning, and they considered that okay because she was kind of running low the whole time being on some of these medications. I did not write down the second one, but it was pretty low. It was like, I think it was like 80/45 or something like that. So it was concerning enough to get some fluids ordered. And that's about it. She just, like I said, the main thing for her was just her pain, making sure that so my nursing diagnosis for this patient was acute pain related to spinal fusion surgery, as evidenced by a pain score of 6 out of 10. Later in the day, she said it was a 4. So it did go down a little bit, according to her. She was in pretty bad pain though. Um, yeah, that's about it. She was on, let's see, she's on cefazolin, which I guess that's something that they give for like an antibiotic to prevent infection when within surgery. And then she was on gabapentin for the nerve pain. And then they had her on diazepam and oxycodone. So those two really, I think, knocked her out while I was there with her. But that is about it for this patient. Thank you.